Thank you, Dr. Boyd, for that, and thank you for all of you for inviting me here. When we talk about cancer survivorship, I could go on for hours, but I won't do that, I promise. But I want to highlight a really important part of cancer survivorship, which is talking about treatment summaries and survivorship care plans. And so some of the objectives, the things I want to talk about today, are to define what cancer survivorship is, describe what the treatment summary and the survivorship care plans are, provide some resources for completing your own treatment summary and care plan, and to define the role of the survivor in the survivorship care planning. And survivorship here at NYU, it started with a small group of individuals. We got together, sort of had a steering committee, and talked about what does cancer survivorship look like. And we created the mission statement for NYU that the survivorship care program is to provide individualized, comprehensive care for all survivors and their families from the date of diagnosis, integrating a model of multidisciplinary wellness care aimed at mitigating or preventing the effects from treatment, detecting cancer reoccurrence at an earlier stage, and improving quality of life for all of the patients in our community. Our program will integrate NYU's world-class clinical care, evidence-based research, and community outreach and education programs, such as this, to aid the patient and caregiver's transition from diagnosis through the acute phase of treatment, and then from cancer patient to a thriving survivor. And so when we talk about cancer diagnosis, a couple of things that that were included in that mission statement is that we define cancer survivorship as when the moment that you are diagnosed. And it's not just about treating the disease. While of course that is the most important thing, it's really looking at the big picture, the 360-degree view of cancer, and cancer diagnosis and treatment. So it's looking at what are the side effects that you may be experiencing, whether they're physical, they're emotional, psychological, spiritual. It includes financial, all of the aspects of cancer care. And and I'm sorry, I guess it didn't show up very well, but what the bottom part has, it says active, extended, and permanent survivorship. And sort of what this encompasses is that survivorship is a lifelong continuum. It's a lifelong journey. I think for many of you in the room, you know that cancer does not end the last day that the chemotherapy is infused or the last day of radiation. Your cancer survivorship is a lifelong journey. And the active survivorship is the time that you're diagnosed, the treatment that you are receiving, whether it's chemotherapy, surgery, radiation. The extended survivorship is in those days, those months after treatment has ended. And some women have described that as a transition, as a watchful waiting. It's a time of celebration, but it's also a time of anxiety and concern. And then the permanent survivorship are those years after diagnosis, the years when treatment has ended. And while your risk of reoccurrence may be smaller, you still have needs as a cancer survivor. And so I think our mission in healthcare is to define what are the needs of the cancer survivor at all of these different phases of survivorship. And as I said, the challenge, this was a quote that was actually by a physician who was also a cancer survivor. So it's the challenge of overcoming cancer is not only to find therapies that will prevent or arrest the disease quickly, but also to map the middle ground of survivorship to minimize its medical and social hazards. And so the reason that we know about cancer survivorship and that we're looking at cancer survivorship as far beyond treatment ends was because in 2005, the Institute of Medicine got together many professionals, physicians, nurses, bench researchers, academia, and they got together and they created this statement. It was called From Cancer Patient to Cancer Survivor, Lost in Transition. And this is actually available online to you as well. It's free. You can buy it as a textbook also and anywhere. And what the goals of the Institute of Medicine report were to examine the medical and the psychosocial consequences of cancer and its treatment. They wanted to define what quality care was for cancer survivors and strategies to achieve it. And then they wanted to explore the social, economic hardships that may face cancer survivors, such as discrimination from insurance, problems in the workplace. And they wanted to, of course, find ways to prevent this, and describe how we can improve what we know about the quality of care and quality of life for cancer survivors and their families. And so a lot of what we know, and just to take a step back, a lot of what we know about the potential late and long-term side effects of cancer and treatment, we actually owe a lot to childhood cancer survivors. And there was a very large study that enrolled about 25,000 childhood cancer survivors in the 70s, 80s, and 90s. And what they did was they compared the childhood cancer survivor to their healthy sibling. And what they looked at was, emotional effects, the likelihood of the cancer patient to graduate from high school, to graduate from college, to have children, to have, bone density problems. And what they found is that while childhood cancer is very different than ovarian cancer, but they did find that some of these treatments and just the fact of being diagnosed with cancer has the potential to cause long-term side effects. And so some of these side effects may be psychological, they're physical, they may be sexual, reproductive, work-related, financial, and spiritual. And so the Institute of Medicine defined what exactly the mission of survivorship care should be worldwide for all cancer centers is prevention of disease reoccurrence, prevention of secondary cancer development, surveillance, making sure that we're most up to date with what should we do to look for screening for disease reoccurrence, side effects from treatment, what kind of interventions are we providing for the cancer survivors, and coordination of care. And so that sort of leads into the treatment summary of the care plan. And this is an important document when we are talking about, if you're leaving the oncologist and you're going to be, sharing care with your primary care provider, it's a document that you take with you, and that's what we're going to talk about. And so really we're focusing on the extended survivorship, the time after treatment has ended, into those days, weeks, months, and years after treatment has ended. And so, some of the points, understanding what your fears or concerns are, talking about them with your family, friends, and your healthcare team, ask for and allow for help, and becoming a self-advocate for your follow-up care. So part of the way that you can be involved and engaged in your care after treatment ends is by this document. This is called a treatment summary and a care plan. And a treatment summary is just that. What was your diagnosis? What treatment did you receive? What were the drug names? What was the radiation? What was the surgery? What was your genetic information? And then with your health care provider, you create this document together. It's called a survivorship care plan, and it helps to guide your follow-up care. It says how frequently should you be coming for certain tests? What are the potential side effects that we're going to be looking for? Any kind of healthy behavior maintenance, smoking cessation, etc., and any referrals that you may need. And so by completing this document with your healthcare provider, it's really engaging you to share, I need some assistance with, a social worker. I'm having a hard time with health insurance. It's really encouraging you to get involved with your health. So why treatment summaries? Why care plans? And so for you, this document will help to improve the knowledge and the understanding of the treatment that you received and what the possible side effects may be. It helps you get involved and participate with your health care, and encourages you, for healthy behaviors after treatment is ended. For providers, such as your primary care provider, it increases the communication, and it helps to facilitate coordination of care between your medical team, your oncology team, and your primary care provider, also any other physicians that may be involved in your care. And the treatment summary, the care plan document, is actually a document that is recommended, and not only recommended, but it's going to be required. 2015 is the year that all cancer centers are going to be mandated to provide these documents. And so the Institute of Medicine stated patients completing primary treatments should be provided with a comprehensive treatment summary and follow-up plan that are clearly and effectively explained. So one of the templates that you can use, you can certainly ask your doctor and say, what is this treatment summary? What is this care plan? Can you provide this document for me? But you can actually yourself go online and complete a treatment summary as well. And so one of those websites, one of the foundations, the Livestrong Foundation, is actually a website that you can go to, it should be in your notes there, where you yourself complete your treatment summary. And then you can share it with your physicians. And in the sake of time, I have some slides in here that sort of show exactly, what each screen looks like, but it's very, very simple. It is also in Spanish, if Spanish is your primary language. I think they're working on other translations as well. But understand this is only one of several ways that, you can complete this on your own. So when you log in, it will ask some basic demographic information. It will ask you what type of cancer that you had. It will ask you what kind of treatment did you receive? Did you have surgery? What kind of surgery did you have? It will ask you about the different treatments that you had, and as you can see, Avastin, which I know has been talked about a lot today, is listed there. And if you didn't receive any chemotherapy, you just click no, and it prompts you to the next page. And so what is generated, and it continues on with radiation, et cetera, and so what is generated out of this is your care plan results, and it explains what your summary was. It looks at what the medications were. It has recommendations for healthy living after your cancer treatment ends. You can bring it into a PDF document. You can print it. You can email it. And one of my favorites is that it actually generates a letter as well. So you can, next time you go for your primary care physical, you can bring this into and say, this is exactly what I received. These are the drugs that I got, et cetera. And again, this is something that, in oncology, your oncologist is generating as well. But it's also nice, in the event that something gets lost in the mail, a nice way to communicate to your entire medical team exactly what kind of treatment you received. And so with that, sort of what you can do now. And, part of the things that we've been providing for you, the education, the whereabouts, the what now, again, childhood cancer survivorship has really brought to the forefront a lot of what we know, and I want to just conclude with one story. So I myself am actually a cancer survivor. I was diagnosed 30 years ago with a bone cancer called osteosarcoma. And when the treatment at the time was chemotherapy and surgery. And as I grew up, we didn't follow up with an oncologist. And it wasn't until I was about 21, 22 years old, my first job as a nurse, when I went in and was working my regular job, and they said, have you ever had a bone density test? And I said, well, no, I'm 22 years old. Why would I have that? And they said, have you ever had an echocardiogram? Have you ever, had an x-ray of your heart? And I said, no, why did I do that? And they said, sometimes the treatment that you received can have lasting side effects. And I can give another example. When I started nursing school, I lost my health insurance, and I had to provide my own health insurance. And at the time, I had to pay out of pocket the pre-existing conditions, and they gave me a notice that I would never be covered if I had cancer again. I would never be covered if I had any kind of problems related to my back. And so I didn't know what to do. I was sort of lost. And so what I did is I made an appointment with an oncologist, and I said, I don't understand, what am I supposed to do about my health insurance? What am I supposed to do about my follow-up care? And they said, well, let me give you this treatment summary. And it kind of defined exactly what I had, what sort of care that I needed. And I took this document to my primary care provider, and I said, I need a bone density test, and I need you to order it for me. And so it really encouraged me to be my own self-advocate. And so you have a picture of me in my bathing suit now, but this, so part of the success of surviving cancer and moving forward, I celebrated my 30 years from cancer diagnosis by competing in a triathlon last year. And so I just encourage you and leave you with this. What lies behind us and what lies before us are tiny matters compared to what lies within us. Sorry, this I lose a train of thought. But what I really encourage you is, to be your self-advocate for your care. You know yourself better than anybody else. And when it comes to side effects, when it comes to, your need for follow-up, when it comes to, your care, I really encourage you to be involved. And I thank you again for inviting me here. And any questions? Where did we go?